Hello everyone. As my disclaimer, I am not a medical doctor and all the informations here are not a medical advice and this is for information purposes only. You should consult your own doctor. Okay, let us begin. What if I told you that we have been lied by the government? We've been lied by the American Heart Association. We've been lied by the pharmaceutical companies because of money. Because of money and profits that put millions of dollars in their pocket, they demonize the LDL cholesterol. They tag the LDL cholesterol as a bad cholesterol, when in reality, this is an angel. This is an angel molecule that protects us. The demonizing the LDL cholesterol and statinization of the whole world must stop because it is dangerous. You are paying yourself every day to kill yourself. Study shows that the higher cholesterol you have, the longer you live. The higher the LDL cholesterol you have, the longer you live. The lower the cholesterol you have the higher chances of developing cancer, dementia, and your mortality rate is high. You will die early if you have a low cholesterol. Cholesterol is a very important functions in our life. It is a very important biological functions in our body. By design, it is made that way, but humans are altering their pathway to make money. So they do everything to deceive us, to exaggerate the facts, to exaggerate the benefits and underestimate the risk. We have been lied, we have been scammed for decades. Now it is believed that by the year 2020, this year, statin industry will reach $1 trillion. And there's probably no way of stopping because they will do everything. They will conduct studies, and we know that studies proving that cholesterol is good are funded. 90% of the studies are funded by the manufacturers. And we know when it's funded by the manufacturers, the result is bias. It is favored to their own interests. The LDL cholesterol is the culprit. But I will tell you that it is not. Cholesterol is not the one causing the inflammation or the cardiovascular disease. It is the insulin resistance. It is the reactive oxygen species that causes injury to your LDL, but that will be in another video. Okay, so let us discuss how the data is reported by the manufacturer so that they can deceive us. They can deceive the doctor who is prescribing this cholesterol. They will report. There are three types of report: the relative risk reduction, the absolute risk reduction, and the NTT, the number needed to treat. But in their trials, they like to use the relative risk reduction because it is exaggerated. How this is calculated? Now it is calculated by dividing dividing the difference of the placebo and the actual trial. Now in this study, the difference between placebo is 1.1%. The reduction rate of placebo is 3. The reduction rate of Lipitor is 1.9. You minus that one, the difference is 1.1. Then divided by the placebo 3, arriving at a value of 36.7%. So they will advertise that cholesterol, taking Lipitor can lower your heart attack by 36%. Wow, that is amazing value. But what doctors did not know is the absolute risk. It is actually the absolute risk that you need to consider. Now, in the absolute risk, it is calculated by the difference, and we have the difference of 1.1. So this is actually a 1% reduction of cardiovascular disease, which means in the NTT, it needs to have 99 patients to treat before the 100 can have the benefits. 1% benefits. So it doesn't sound good considering the side effects, considering that your muscles will die, considering that you will develop fast a type 2 diabetes, considering that in the future you will develop a lower cognitive functions, Alzheimer's, dementia, and also you will also prone to develop cancer if you take this drug. So if they want to exaggerate the data, they will use the relative risk reduction, which is 36%. And that is why if you ask your doctor, the risk of reducing heart attack is 33 or 36%. And that is a relative risk. It is a scam. It is a deception. It is not the actual risk. It is not necessary for us considering the side effects. So in order to understand more, because by taking statin, you are eliminating all of these biological functions. And let us review the biological functions that you will be missed because you're eliminating it by taking statin. Here's the function. Number one, it involves in cell injury and fluidity, so therefore it protects your cell membrane. And it's also involved in cell signaling. By reducing your cholesterol, you reduce your cell signaling functions, which actually reduce your cognitive functions, will develop Alzheimer's disease and other dementia. So cholesterol is a precursor of the steroid hormones like estrogen to make your wife look pretty, as Dr. Ali Nader said, and your husband looks very handsome, as Dr. Ali Nader said also. And it is also involved in the productions of stress hormones, productions of bile acid, which is very important in the lipid metabolism. And it's also important in the cognitive functions, because the more cholesterol you have, the better your cognitive functions, and reduces the risk of dementia. Now, it is also involved. Cholesterol is involved in the productions of vitamin D. Now remember, if you have a kidney disease, you are more likely to develop a very low amount of energy because your kidney is not functioning well. Taking statin will aggravate the condition because you're also reducing the vitamin D production in the mevalonate pathway because it was blocked by statin's drug. So the other functions that we need to dive in is the LDL cholesterol, which is very important. Now remember again, by taking statin, you will eliminate a lot of this very important function that is needed for our life to survive at an optimal health. Okay, now the LDL is responsible as a carrier molecule, like a FedEx, delivering packages of cholesterol and triglycerides to the different organs that needed for cell repair. It is also responsible for delivering CoQ10 enzyme that is needed for muscle strength. Without CoQ10, you cannot produce energy that will supply to your muscle. So therefore, your muscle will die if you take statin because you have a reduction of CoQ10, and that will show in your blood. The elevated aldolase enzymes, elevated CPK, creatine, phosphokinase is an indicative of muscle death because you're taking statin. Also, another enzyme that will elevate is the ALT, the alanine transferase in your liver, which is indicative of liver damage. So taking statin can make your liver and muscle die. Another functions is the conversions of phenylalanine or vitamin K1 to menaquinone, vitamin K2. It is very important to convert these because vitamin K2 can prevent vascular calcifications in your artery, preventing heart attack. Because vitamin K2 has a receptor site of osteocalcin, which is responsible for depositing these calcium molecules from your bloodstream to be deposited in the right spot, your bones and teeth. If you are lack in vitamin K2 because you block the conversion of K1 to K2 by taking statin, your chances of developing atherosclerosis is high. It is also involved in our host defense, very important host defense. LDL molecule, according to Dr. Ali Nadir in Houston, Texas, a cardiologist, the LDL molecule is responsible for mapping out the quorum sensing protein responsible for the proliferations of the bacteria and viruses. So, another is the dolichol. I believe the dolichol is responsible for the accelerations of your side effect type 2 diabetes, because this is responsible for functions in an insulin receptor, and it's also responsible for insulin growth factor 1, a very important molecules in the anabolic process of proteins, and is also involved in in-link glycosylations and also another important biological processes in the body. Another one is body repair. So any cells that are damaged, they package this cholesterol to help repair the damages. So this is why very important. Now, to understand the pathway, the food that you eat will be converted to glucose, and then through glycolysis will be converted to pyruvate and acetyl coenzyme A. It is then this acetyl coenzyme I will enter into the biosynthesis of cholesterol called the mevalonate pathway. Two molecules of acetyl coenzymes A combine together to form acetoacetyl coenzyme A, which then converted to HMG, which then converted to HMG coenzyme A by the enzymes HMG coenzyme synthase. These HMG coenzymes A will be converted to mevalonate in the presence of HMG coenzyme reductase. Take note, these steps here is a rate limiting step. It is the most regulated step in the body. It is where the statin drugs act the inhibition of this enzyme HMG coenzyme A. These mevalonate pathways will be converted to a lot of molecules, maybe 30 steps, to produce cholesterol. And in the process, I will skip some of these molecules and also mention only the important ones. This mevalonate will produce IPP or isopentenyl pyrophosphate to produce selanoprotein, which has an antioxidant properties. It produce and helps the conversions of vitamin K1 to K2, preventing vascular calcifications and preventing heart disease. Responsible for the conversions or productions of dolichol molecules, which I believe responsible for the accelerations of your side effect type 2 diabetes. It's responsible for carrying CoQ10 molecules, and CoQ10 is responsible again for the productions of energy in your muscle. Without this, your muscle will die. Productions of lipoprotein LDC molecules to carry all of these CoQ10, carry dolichol, and that's also responsible for carrying the vitamin D molecules, which I did not put in these slides. So you can see that a lot of biological processes that is very important to the body will be taken away by taking statin like atorvastatin, fuvastatin, luvastatin, pitavastatin, pravastatin, rosuvastatin, and simvastatin. These are all statin drugs that will inhibit the HMG coenzyme reductase to produce mevalonate. So by taking this one, we are reducing mevalonate, reducing all of this biological effect, which is very deleterious, detrimental, dangerous to your body. So that is why it's not necessary to take statin based on study and evidence. So, and these are all the links, if you want to dig further, what I'm talking about, and so that you will believe. A lot of brilliant scientists, doesn't believe the current theory of LDL as a bad cholesterol. So thank you for watching, and click subscribe and notification bell, but please share to your loved ones these links, because this might help them. And these are the other links of all my videos. But before I close, I will show you the evidence in the trials that the higher the cholesterol, the longer you live. So So here it is, some studies